Neonatal Care Part 7, continuing to talk about specific conditions that affect the newborn. Neonatal jaundice, thermoregulation, fever, and hypothermia. Neonatal jaundice, it results from immaturity of the liver to conjugate bilirubin in the first week. Can result from hemolysis, red blood cell disorders, polycythemia, or excessive bruising. Severe hyperbilirubinemia can lead to kernicterus, which is a form of developmental delay from the deposition of bilirubin in neuronal tissues. Cholestasis can present after the first 2 weeks and can result from hepatitis, metabolic disorders, or prolonged total parenteral nutrition. Transport is essential for the newborn or the neonate who's experiencing jaundice. Start them on IV fluids if they show significant clinical jaundice, and communicate with medical control. Usually phototherapy is the treatment in most cases. Thermoregulation. Thermoregulation is very limited in a newborn. The average normal temperature of a newborn is around 99.5 Fahrenheit or 37.5 Celsius. The range for a neonate is 97.9 Fahrenheit to 99 Fahrenheit. The production of heat by metabolism or non-shivering thermogenesis is the newborn's primary source of heat production. Brown fat is a substance that's unique to newborns and is deposited in the fetus after 28 weeks of gestation. It's stored around the scapula, the kidneys, adrenal glands, neck, and axilla. Heat loss occurs when heat is lost to the environment. Fever. Rectal temperature greater than 100.4 Fahrenheit or 38 degrees Celsius. Oral temperature is usually 1 degree lower than rectal temperature on average, and the axillary temperature is usually 2 degrees Fahrenheit lower than rectal temperature on average. A newborn may not always present with fever in an illness or infection because of the immaturity of its temperature regulation system. They may become hypothermic or hypoglycemic instead. Neonates who appear well but present with fever carry an approximately 7% chance of having a serious underlying bacterial infection, and the fever may be caused by overheating or dehydration. They have limited ability to control their body temperature. They don't sweat when they're hot. They don't shiver to raise their temperature, and their core temperature may drop with serious life-threatening infection, and this may give them a higher risk of hypoglycemia and metabolic acidosis. Signs and symptoms include irritability, somnolence, decreased feeding, and feeling warm to the touch. Examine for presence of rashes. A lot of times rash will develop with fever. Petechiae, a pinpoint red, brown, or purple skin lesions, and examine the soles of the feet and palms of newborns with dark skin. Obtain a careful history about their general activity, feeding, voiding, stooling, and note increased respiratory rate and work of breathing. Obtain your vital signs. Perform chest compressions if indicated. Cool the patient. Antipyretics are controversial in the field. We do not give Motrin or ibuprofen at all. Hypothermia. This is going to be a drop in the body temperature to less than 95 degrees Fahrenheit. It's more common during the winter months, and moderate hypothermia is linked with the increased risk of death in low birth weight infants. Newborns have increased surface area to volume ratio and are sensitive to environmental conditions, especially when wet after delivery. You can see in this list right here risk factors for hypothermia. Hypothermic newborns may be cool to the touch and pale with acrocyanosis, and they may also present with a handful of symptoms including apnea, bradycardia, and central cyanosis. Warming hands before touching the newborn is important, and making sure that the newborn is thoroughly dried after birth and putting a cap on the head. If the newborn's hypoglycemic, you may give D10W per local protocol. And once stabilized, cover them and keep them warm in transport.